Yes, good morning once again. It is another bright day, and we thank God for the new day. Like I had promised to come back with the Dr. Tambaki Edmond, and I told you this man is very specialized in these topics you are talking about, because apart from being a doctor, he has a master's in nutrition, precision, and genomics. He also has nutritional oncology, that is master's in nutritional oncology. So he deals more with the cancer patients, but he can help us digest and explore how we can use the food we eat, the way of life, our lifestyles, in controlling most of these lifestyle diseases. Good morning, Dr. Edmond.
Good morning.
Yes, how are you?
I'm okay, and good morning to our listeners.
Yes, last time people listened to your video about the other topic, they were all surprised. People were asking, how can a person of your age have all those books? But I told them that it is our benefit to benefit from the books that you have had. Thank you for the last video. People are appreciating. We thank God for the knowledge that He has given you.
Good. But you see, the books may not be the issue, but everything is possible by God.
By God.
Everything is very possible. It also depends, where you study from.
Okay. Yes, Dr. Edmond. Today we want to talk about something, what we call fasting.
Yes.
Fasting is something that many people have used. Some people say that they even use it when they are sick. Others use it at church. Others use it to lose weight. Others use it in different ways. So as a doctor who is specialized in the lifestyles of sick people, in nutrition, as a specialist in nutrition, oncology, and the way how people live, what is fasting according to you?
Well, actually, fasting we can term it as a period in which we go without food.
Which you go without food.
Yeah, but again here we have to be a bit careful, because fasting and starving, they are almost similar.
Hey. So
when you starve, that means that you don't have something to eat, neither to take. And the same with fasting. But with the fasting, you have a goal towards what you want to do. But with starving, we just don't have anything to eat.
Oh.
Yes.
Okay. So we can say that starving in starving we are not eating. In fasting we are not eating. Only that for starving you don't have, but for fasting you may have, but you are intentionally.
Exactly.
Yes.
Intentionally not eating.
Not
for
eating.
a specific period of time.
Specific type of time.
Yes.
So now, are there types or?
Actually, there are a couple of types in fasting, and it depends on your mood. We have, as Christians, we do fast. Yes. Even Muslims do fast. That is spiritual.
Yes.
And then we have intermittent fasting. This is whereby you take a specific period of time intervals without eating. Yes. Intermittent, it can be you may not eat breakfast and you start eating at midday. All your dietary intake, the calories, you eat them in one sitting, just 1 meal a day. You can decide with it. Fasting, you can say to eat at midday. Yes. But again, now this is a high fat, low calorie
fasting. You
yes.
eat like 1 meal a day.
You can eat 1 meal a day. But now that meal has to be a bit specific. It's high fat. It can be high fat, low-calorie diet.
Mm-hmm.
The carbohydrates are low, and the fats are kind of around 2,000 calories. Yes. Then we have also the juice fast, whereby you don't eat anything. You only take juice, specific types of juices, depending on what your intentions are. Then there is also a water fast. Then we have a dry fast. Dry fast is mainly practiced by Christians. Dry fast, no eating anything from morning, from sunrise to sunset. No eating
Dry
anything.
fast.
Yes.
No water, nothing.
No nothing.
So, so there's dry fast, there is spiritual fast, there is a juice fast,
Yes,
and intermittent.
exactly. But I think
Okay.
of recent, intermittent fasting has taken the center stage.
Okay.
Yes,
That means that there should be some reasons why we do this type of fasting.
exactly.
Why do we do fasting?
Well, first and foremost, we do fasting depending.
Because now when you talk of spiritual, we can at least know that that is spiritual part of it.
Exactly.
Yes. But now these other types, you are talking about the juice, the intermittent, the other one was what? The juice,
Water
intermittent,
fast.
and water.
Yes.
Especially those three.
Now, those three, well, when you look at intermittent fasting, actually, generally with the fasting, people who do practice fasting, they do experience a surge in their energy levels, increased energy levels. Two, alertness. They are always alert. And three, during fasting, we're actually cleansing our bodies,
Okay.
especially those who are doing the juice fast. You do specific types of juices which help in detoxification, and these juices help the liver in the stage 2 detoxification.
You
The-
do juice fasting.
Juice fasting, then intermittent fasting, yeah, especially now like the sick.
The sick.
Yeah,
Like which sickness now?
you can talk about cancer patients and those
Right.
with GI problems.
Oh.
Yes, they can also benefit from that. But however, I always recommend those who are severely malnourished not to do fasting,
Okay.
because with the fasting always we experience muscle loss. Yes.
So it means that fasting can be beneficial.
It's very, very, very beneficial when it comes. Actually, I would say that it should be even part of treatment.
Very
Yes, it should be part of treatment, because why? During fasting, especially after 48 hours, at most after 48 hours, there is a process which is called it's the autophagy that kicks in. Autophagy, this is a process whereby the body starts, self-cleansing, and that one always starts between 24, in some other scenarios between 16
That
hours.
is over a day.
Yeah, in other people, depending on our makeup, between 16 hours and 48 hours, autophagy kicks in. Autophagy, this is a process whereby the body kicks into survival mode, into self-cleansing. And at this point, the body is trying to use the fats as energy. At the same time, the body tries, to utilize the waste products. It will convert the waste products into beneficial
But
nutrients,
doctor,
proteins.
doctor, before you go, because when you talk of 16 hours, it means if I have eaten lunch today, I'm supposed to 16 hours will end tomorrow.
Yeah, sure. With like
Tomorrow.
intermittent
That
fasting,
one lead to ulcers or
not really. It won't lead to that. But what I was saying in the 16 hours when you eat, of course, you're going to spend quite a number of period of hours without eating, then you eat something. But again, what you're eating, mainly it should be high fat. With the high fat, we're not talking about the refined oils. No, we are talking about how can I say? I want to say it in a layman's language.
Yes.
In fats which are beneficial to the body, like extra virgin oil or cold pressed oil. So you said there you don't use the refined oils. You have to use cold pressed oil because of their immense benefits into the body. Then also having a low carb diet.
Okay.
Why? During that fasting period, what we're gonna experience is the body is going to use the fats for energy.
Yes.
Fats for energy. That is our target. Whereby you're going to look healthy and all that. At the same time, you're fueling other internal activities on at intracellular level.
So it means that I can have lunch now, then I plan to have another lunch tomorrow, but in between there, maybe I can have a fruit.
You can have a fruit, yes. You can
As
have
my
salad.
supper, yes.
Exactly.
And the tea or
Yeah, green tea, it's okay.
what
Green
of
tea.
honey tea? Oh,
Yeah, it's okay.
it's also okay.
Yeah, you can sweeten it with honey. Yes, but mainly at the end of the day, the target should be you are trying to fight something. You're trying to prevent something. You're trying to achieve something.
Achieve something.
Like weight loss, those to improve on the immune system, especially when you're sick. You have been eating a lot of junk. So during that intermittent fasting, when you're actually down, sick, that process of intermittent fasting, the body tends, now to get rid of the free radicals, the dead tissues, dead muscles, dead cells, and all that. Some of them they are converted into proteins. That's when autophagy kicks in.
Okay.
Yes.
So in other words, the benefits of fasting could be to improve the immunity, like you said.
To improve the immune system, it cell regeneration,
Cell regeneration,
weight loss, boost energy.
boost energy,
Yes, and it also helps in the quick recovery of patients.
quick recovery. Hey,
Yes.
for us, we know when you're sick, you need to eat this one, and the egg, you eat juice, you take yellows, you take soda, we take.
And now surprisingly, our bodies they are made, in a very, malicious way. In a way that when you're sick, many times, you won't have appetite to most of the foods, but they're going to do those specific foods. I always tell people that you follow your heart, but go with your brains too. Many times when, now for instance, people who are anemic, they're attracted to soy. Not because they are changing their diet. The body is trying to communicate to you, I'm lacking iron.
Like pregnant mothers.
Exactly, I'm lacking iron. The moment someone starts is having that high affinity to soy, just know that the body is trying to communicate. I need what? I need iron in the body. If you're developing flu, cough, and all that, many times, we find ourselves to the other side, of the coin. We need now more fruits. That aroma of fruits, it can, knock you down. Why? The body is trying to tell you, hey, why can't you get some vitamin C for quick healing? And even those who are sick, you find someone, yes, we may talk about, low appetite and all that, but what do they want? You always first give a patient the chance. What do you feel like you want to eat? They will tell you. And they don't always eat all the time. They don't. Unless in certain circumstances.
Like in 1 month, how many times do I need to have this intermittent fasting?
You can do it in a month. You can do it once a week.
Once a week.
Yes, and 2, it depends on your reasons why you want to do it.
Okay.
Why you want to do it. So, some people just, they are used to it. They just want to do it as a formality. Others, because of some complications, stomach complications, like, let me get off food for a while. Others, when they are trying to fight their weight.
Last time you talked about that the problem we have is appetite.
Appetite is actually the number one culprit.
And last time I saw in a party someone adding, and this thing is tempting. They make a lie, they put Irish, they put matoke, they put chapa, they put brown rice, they put red rice, and somebody piles, then they put soda, and somebody eats, and because there's a party, you have to enjoy. And somehow, I think somebody lacks choice and has to take everything.
But you see, when we go back to the Bible, I think it's was it the psalmist? The psalmist or Solomon? That when you are invited to a table to eat with the kings and you're a man of appetite, it's better you put a knife on your throat.
Hey.
Yes. Don't let appetite lead you into something bad. And many times when eat food because you need it, the body is requesting for it. But at times, we always even don't give time for the food to be digested. Because when you eat food, it's not automatic that you're going to eat before you leave home. Actually, this is what most people do. In the morning, is going to have, a cup of tea with
maybe bread.
Bread, yes. Then you reach at work. At times it can be bread and cassava in the morning. Then when you reach your workplace at 9 or 10, again you're going to eat food. Rather something to eat, breakfast. They can bring in, mandazi, chapatis and all that.
Yes.
Then
at lunchtime.
After 3 hours, again you're eating.
Yes.
Now we are feeding like
and in the evening as you are moving, you also get some casserole.
Exactly.
Yes. At night at 8 or 10 actually, even 10 you eat.
Truthfully speaking, that is
so you mean that is bad?
That is unhealthy eating.
Hey.
When you eat cassava in the morning, how long does cassava take to be digested in the body? We are talking about 6 to 8 hours. That means that you have to eat after 6 hours or 8 hours. Why? Because now your body needs.
But you can feel hungry.
Eat only when you're feeling hungry, but don't eat because food is given to you there. Someone has eaten from home, you reach at your workplace or wherever you have reached, you find something that is enticing you eat, but you're still, at least you have to have a bite. No, that's wrong.
So what is the disadvantage or problem you can get if you eat within 3 hours?
Indigestion.
Indigestion.
Yes. And the culprit of all digestive issues, poor feeding and indigestion, will bring all other things.
So are we likely to end up into obesity,
hyperacidity and all that? Then people start complaining, ulcers here and there.
For us, we know ulcers comes when you didn't eat.
But again, because when you talk about ulcers, medically these are wounds.
Yes.
Now, because you're eating frequently, so the body is going to be overworking the digestive system, the stomach. So a lot of acid is being poured in. What happened?
Okay.
Hyperacidity.
So suppose in between in the morning when I eat cassava and lunchtime, I take maybe fruits.
Okay. When you eat fruits, yes, eat fruits which are going to quicken the digestive system, the digestive process rather, like pineapples. They are so good at that.
Okay.
Yeah, but the goal is you eat, then depending on what you have eaten, that's when you're supposed to. And when you're eating, try to listen to your body. When you reach that point of satiety, stop eating.
Stop.
Yes.
So when we are eating, it means we can end up, instead of getting something good, creating some problem.
Yes, will create a lot of problems to us.
Oh.
So now that's why intermittent fasting can help to take out all the bad habits. Because a point reaches where by now you're going to eat in the morning, then you'll eat in the evening.
Okay. So in other words, even fruits, if they are not taken in time, they can also not be good. They also need to be taken in time.
Yeah, sure. Actually, we should avoid eating in between.
In between.
Yeah, in between meals, that is very dangerous. Shouldn't eat in between meals.
Okay. What of these other natural foods, for example, sugar cane? Those ones we thought it has good sugars in their body.
Exactly.
Can they increase also glucose levels, or
actually,
if I'm fasting and I take my sugar cane, could it also be a problem?
no, it's not a problem. Now it depends. Is it a juice fast?
No, okay.
If it's a juice fast and you have decided to do sugar cane juice, well and good. Because that sugar cane, at the end of the day, we are talking about glucose, which is going to give you more energy. Yes. But again, too much glucose again is going to affect the liver. That can be a story for another time.
Okay. Now, your cancer patients.
Yeah. Now with the cancer patients, actually, intermittent fasting.
Okay, all patients, but specifically now cancer patients.
I do recommend fasting. On condition, if they are not malnutrition. You can be a cancer patient when you're not malnutrition.
Yes.
You can do fasting. And with that fasting, it's advisable to seek, guidance from your physician and your nutritionist. They can guide you how to do the things. What food you're supposed to eat, what are you going to eat, what side effects will be there, depending on your cancer type.
Okay. Oh, that is interesting.
But again, now with the cancer patients, when it comes to fasting, a cancer feeds more on glucose. But again, so during intermittent fasting, here we are looking at less glucose in the body. In doing that, you are boosting the immune system to fight. But again, what you should know is that in the absence of glucose, still cancer can still thrive, because it gets its energy from fermentation.
Okay.
So there, we have to be so wise in that. That's why I say that you have to seek the advice
from who? A specialist.
A nutritionist or a physician who will guide you on how to do it.
Okay. Yes, as we are ending this program, what could be the advice you can give to people who, because sometimes people tell us that, I don't know whether they are professional people, that you come, we test your blood group, then we can know the food which you need to eat or which you don't need to eat, so that you can lose weight.
Actually, let me talk about the latter. With the weight, very many people have failed to shed off extra pounds. Why? Because they are looking at the symptoms and the signs of an underlying condition. What if your obesity is as a result of hormonal imbalance? And I'm giving you lemon. That weight will never, subsidize. No. So with the weight, someone who is obese, sit with that person and find out what caused that. The moment you know the cause, that is the end of the game. You're going to shed, a few pounds very fast. Within a week, there should be, a significant side.
But depending on whether, on the cause.
On the cause, is it poor feeding that is eating a lot of junk food? Could it be your weight? Could it be as a result of the medication you're taking? Could it be as a result of hormonal changes in your body? Could it be, with the genes?
Yes.
So all those have to be put into consideration. The moment you get to know the cause, the root cause of those extra kgs you possess, then shedding them off will be so easy for you. So easy. But it's not all about try this product, your weight is going to go down. You do lemon, you do fasting. There are people whereby they eat just a piece of banana as food in the morning. They will never feel hungry throughout the day. And in the evening, they will just be forced to eat. But, their weight is just accumulating. They have a metabolic syndrome. Try to tackle that. Yes.
And that one is tackled by the specialist.
Exactly.
Okay.
So all those out there who want to lose weight, it's always better to put into consideration. Ask yourself, what led to these extra kgs I'm having? The moment you know the root cause, then you can, go and seek for guidance from a specialist, and you have to be open. These extra kgs are as a result of my behaviors in eating. I eat a lot of junk. How can I do to avoid that and reduce the weight? Now you're eating all those junk. Why? Maybe, for instance, when your estrogen levels are high, you have high affinity to sweet things. And now these sweet things, fats are the end result, and someone is going to be bulking up. And other reasons.
Okay. So, how many kilograms is someone supposed to have?
Now with that,
in order not to know that here I'm doing badly, here I'm doing well.
Now that will depend on what? On your gender and your height.
Gender and height.
Yes. Because someone who is around maybe 6 feet, probably that person again would be very obese, or rather obese. Anyway, all in all, it depends on your height and gender.
Okay.
Height and gender, then the years.
Okay, thank you so much, Dr. Edmond. Yes, we have, maybe as we are finishing, we have been having Dr. Edmond. Dr. Edmond, what is the last word you can give to people who do fast?
The last closing remarks, I would say that I would encourage them to continue fasting, especially to practice intermittent fasting. And they have to be disciplined.
Disciplined.
Yes.
Because you say intermittent fasting, it can range between 6 hours, 8 hours, 16 or 24.
Exactly. And the two, when fasting, actually when breaking the fast again, don't go into the junk foods at the end of the day. That means that you have done nothing. You're just starving.
What should be taken after this fasting?
You should eat healthy, and it should be a balanced diet.
Balanced diet.
Yes.
Our Muslim friends normally take fruits.
Actually, they are so good. Actually, when you're breaking the fast, you have some little bit of water, then fruits, alkaline fruits, not acidic, because your body has been empty.
Okay. Yes. What of proteins?
Yeah,
Would
protein.
be the ones we can bring first, or fruits first?
Many times you first do the fruits, alkaline fruits, then after 30 minutes, then you eat. Yes. When you're breaking the fast, a glass of water, then do some little bit of fruits. You begin with the soft foods, not the hard one. You're breaking your fast because you're too hungry. You're jumping into, a bowl of rice and cassava and all that. No, be slow. Just be disciplined. The food is yours. And at the end of the day, know the reason as to why you decided to fast.
Okay.
We don't fast because we want to gain more appetite and eat a lot of food. No. Fasting should be beyond that.
So people who do gym and you are intending to go to, or who do athletics, do they also have to fast?
Yeah, sure, they do. They
So-
have to. But again, people who are doing such heavy activities, they should also be mindful of the foods that they are eating. Don't eat food with a lot of proteins and less carbohydrates. You need the energy. And you have to balance the proteins and the carbohydrates. Because the proteins, we are looking at the muscle, then the carbohydrates is energy. So if you are an athlete or you're already doing training and you're doing a lot of carbohydrates and less protein, now there is a problem somewhere. Neither vice versa. So everything has to be balanced. Yes.
How do I know that this intermittent fasting is not taking me into loss of energy? This thing they call hypoglycemia. How am I supposed to regulate myself?
How you're supposed to regulate yourself? Like as I said before, when you're going for intermittent fasting, try to talk to a nutritionist who will guide you on what to eat, how to balance energy levels, your body mass, all that.
Thank you so much, Dr. Edmond, for your time. Shall we meet another time? I think when you're talking about diabetes, which is also a common problem, which I know you deal with in your patients, and you are going to discuss on it. Thank you so much. God bless you.
God bless you too. Thank you, everyone.